Hi, Dr. Hardy here. This is part one of my series about boy boobs, aka gynecomastia, and I hope you enjoy. So, first thing I want to say is the definition of gynecomastia is basically when boys or men have abnormal growth of glandular breast tissue. So, this is a slide of a little boy holding his left chest in pain. Actually, I couldn't find a good photo of a boy in puberty. He looks a little bit younger than puberty, but basically it's like a boy who might be between, 13 and 14 years old who complains of a painful lump under one of his breasts. And that is called physiologic puberty. And we'll get into both physiologic, which is kind of the normal course of development, versus pathologic, which is not normal or something. There may be an underlying disease or cause. So here's an older man where you can see some breast tissue in him. This is a slightly exaggerated picture, but I really wanted to get the point across because gynecomastia comes in a lot of different shapes and forms. It can be really small, almost like a cup breast on a boy or a man, or it can look very large. And of course, sometimes obesity plays a factor too. So what are the causes of gynecomastia? It's basically when male hormones go down in boys and female hormones are going up, and both male and female breast tissue respond the same to the female hormones, and so they start to develop breasts. Everyone has a little bit different sensitivity to the hormones, and it depends on the length of exposure to these hormones that will affect how rapidly they grow. So there are several causes of the hormone imbalance, because I know the next thing you were asking, like, well, if female hormones go up, male hormones go down, what would be the cause in some boys and not others? And so there are a host of issues that can cause this imbalance in hormones. And in small parentheses, I talk about neonatal breast hypertrophy, which basically is when babies are born and they have a little lump in their breast and sometimes a little milk comes out. And that's a physiologic cause, but at the same time, the reason why is because mom's circulating hormones are in their body still, and so female hormones are high in the baby's body and male hormones are low. So that's a perfect example, and as the baby grows and as mom's hormones get out of the baby's system, now the baby's normal hormones, we're talking about boy babies here with gynecomastia, but it can happen in girl babies too. I spoke a little bit about pubertal gynecomastia, so that's physiologic when boys are in puberty and they may have a lump under the breast, but that's transient. And as they go through puberty, the testosterone starts rising, and so it shifts the balance to testosterone being higher than the estrogen in the boy. You can have some hormone secreting tumors, genetic syndromes, infections, and much, much more. The list goes on and on. So, to limit my time talking about it, I will not be talking about all of these different reasons. Drugs like marijuana can cause gynecomastia if you smoke a lot of it. But my population tends to be, of course, because I'm an obesity medicine specialist, usually I'm dealing with either children or adults who have elevated BMIs, and I usually screen them for gynecomastia because sometimes it's not just, baby fat or extra fatty tissue that's giving the appearance, and that's called pseudogynecomastia. So it's not true breast tissue under there, but it's my job to do a breast exam on these boys and see if they really have true breast tissue or is it just fatty tissue. So here it says elevated BMI, pseudogynecomastia versus true gynecomastia, conversion of male hormones to female hormones. So let me stop right there. So I talk about fatty tissue conversion of male hormones to female hormones versus fatty infiltration of the breast. So it is, they think it's, not a fact at this point, but studies about this are leaning towards the male fatty tissue in the breast actually converting these male hormones to female hormones. So think of these fat cells as little machinery bubbles, and within those bubbles of fat, all of this stuff is going on, activity is going on, and there are enzymes and proteins. And I may be going over your head, but just know that there's testosterone and hormone and other hormones in those cells, and we believe, or studies, are leaning toward the conversion as an enzyme converting testosterone to estrogen in the actual fatty tissue itself. So here's a picture of a breast exam. And basically the provider is pinching the breast at the base and moving forward toward the tip, and underneath the nipple or areola you may feel a symmetrical mass or tissue there. We call it fibrous tissue, and that's true gynecomastia. And this is a good picture because this man doesn't have huge breasts, right? It looks like a little, a girl who's just starting to grow breasts or something, but there is breast tissue under there. If you feel something hard and symmetric, we call it indurated or a little hard and symmetric. Whereas in pseudogynecomastia, there's no discrete ridge or demarcation of the glandular tissue under the nipple. So I hope you enjoy part 1 of this series, and hopefully part 2 will be up within the next week or so. Bye guys, I hope you enjoyed.